Hi, this is Brandon with ChiroUp, and I want to tell you about my favorite orthopedic test. My favorite orthopedic test in the lower extremity is the C sign. And the reason it's the most important test and my favorite test is because when a patient walks in and they make a C, like this, and they put it around their hip and say, this is where my pain is at, I can say with a very high likelihood that's a hip problem. And that's important because now I can move into my hip orthopedic exams or functional exams as compared to moving into my lumbar orthopedic exams. And I love these kind of clinical prediction rules because they're almost always right and it saves me time, which ultimately helps my practice and lets it grow. Unfortunately, there is a subset of low back complaints that mimic hip complaints. More importantly, they radiate into the hip. These are upper lumbar spine disc problems. There's a great paper that just came out in the Journal of Orthopedic Science, and they looked at the distribution of pain and paresthesia extending into the leg, and then what levels are affected, and then more importantly, the symptoms they produce. And what they found is that if you look at L2 and L3, you start to see radiation of pain extending into the thigh, into the groin, and more importantly, the medial knee, all above the knee. That sounds a lot like a hip problem. So when somebody comes in with a C sign and they say, here's where it is, more than likely it's a hip problem. However, it could be an upper lumbar spine issue. So how do we differentiate that? What are the tests that we can use in our office to quickly make that differentiation? And it's just flexion and extension of the hip. More importantly, the SLR and the femoral nerve stretch. And those are the biggest ones that I use in my office. So here you see is the SLR. With the SLR, you're really going to be putting tension on L4 and L5, the nerve roots and S1. When you start to get hip flexion with the SLR, remember, you're also flexing the hip, so that could also reproduce pains extending into the groin with more impingement syndromes, or more importantly, the CAM impingement, or a hip osteoarthritis, or some kind of other intra-articular pathology. However, let's look at the femoral nerve stretch. Here what we see in the femoral nerve stretch is we're moving the leg into extension and the knee inflection, and now we're starting to pull on the femoral nerve. This is important because now we're getting nerve symptoms if this was a test that was positive. So when I pull the leg backward, if I start to get a burning sensation, a radiation of pain extending into the anterior thigh and groin, that is much different than a localized pain, a sharp pain, which could be present in more of a labral lesion of the hip. So, in recap, if you have an SLR that's positive, you're looking more at reproduction of symptoms, or nerve-related symptoms extending down the back part of the leg if it's a back problem. If it's a hip problem, it's going to be a localized pain at the groin. If you have a femoral nerve stretch that's positive, you're looking for reproduction of pain extending into the thigh and groin, and less pain extending as far as the hip being a localized pain in the groin area. So what this paper found is that they looked at the different groups of lumbar spine disc herniations, and what they found is that when you look at an L2-3 nerve problem, you are going to get reproduction of pain extending into that crease in the groin area. If it's going one level below that L3-4, you can start to get the anterior thigh, but also extending into the medial knee. So make sure you match up the patient's problem to how you're going to reproduce their complaint, and then most importantly, how you're going to differentiate between a hip and a low back complaint. Sometimes it's very simple. It's a C sign, positive, to go for is a hip. But other times it's not so simple. So making sure you incorporate the SLR and the femoral nerve stretch into your clinical prediction rules to make sure you're leading along the right path, because if you can get on the wrong path, unfortunately patient outcomes can go downhill. Thanks for listening to the blog. You can check out more information on how to assess, how to treat, and all the rehabilitation exercises for all the hip complaints. That includes CAM impingements, it includes greater trochanteric pain syndromes, and your hip osteoarthritis. It also includes lumbar spine disc problems and radiculitis, their extension or flexion bias in ChiroUp. So no more will there be a question of which test should be positive, what are the most sensitive and specific tests. We've done all that for you. As soon as you make the diagnosis, ChiroUp does the rest. It gives them the most appropriate advice. It gives them the most appropriate information on their condition. It lets them know any kind of change in their habits and hobbies they can make to help get themselves better. And it also gives them the rehabilitation exercises done for you. Most importantly, it's going to harvest those positive results you get with your patients through Google reviews. And then you can also send all those clinical results to your medical friends to help harness some more medical reviews. Thanks for listening, and I'll talk to you next week.